Today's health headlines: how weight loss, intentional or not, could be linked to cancer, an HPV vaccination program that has been proven to prevent cervical cancer, and a new symptom of long COVID has been identified. Joining us now, Associate Professor at Yale School of Medicine and Yale Medicine physician, Dr. F. Perry Wilson. Thank you for being here, Doctor.
Thanks for having me, Darren. Lots of interesting new research out this week.
A lot of stuff going on. Let's start with the research that has found that individuals who lose more than 10% of their body weight over a 2-year period were at a larger risk of being diagnosed with cancer the following year. Tell us about that.
Sure. You know, doctors often notice unintentional weight loss. If a patient comes and says, yeah, I've been losing all this weight, I haven't been trying, that raises some alarm bells and we'll often go digging deeper. This study, which was of about 200,000 people across the United States over 15 years or so, found that even people who were intentionally trying to lose weight by increasing their exercise and improving their diet, if they lost 10% of their weight over 2 years, in the future, they had a higher risk of cancer as well. Now, I don't want to make people worry that weight loss causes cancer. That's certainly not what's going on here. I think what this study tells us is that actually losing weight with only diet and exercise is pretty tough. And so if you're very successful in that, a lot of those people are just good and have done a good job and are losing weight, but some might be losing weight for another reason, and it's something we may need to be aware of.
Pretty interesting. All right, another new study found that of the women fully vaccinated against HPV while they were aged 12 to 13 in 2008, not one of them developed cervical cancer. Tell us about that one.
Yeah, you know, HPV, the human papillomavirus, is essentially the main cause of cervical cancer worldwide, and the vaccine is highly effective. This is data coming out of Scotland, which tracks the health status of all of their citizens, and they started vaccinating in 2008, and what they found since that time is that at least among those who were vaccinated at the recommended age of 12 to 13, not one case of cervical cancer, which is really impressive. For those vaccinated a little bit older at 14 to 15, there were a handful of cases, but still dramatically lower than what you saw in the unvaccinated population. So it really is a successful vaccine that prevents cancer. So, you know, you definitely want to think about that if you have a child who's in that age group.
Great news. All right. Insomnia, now identified as a long COVID symptom, affecting about 76% of people who had COVID within 6 months. What do you know about that?
Yeah, these numbers are really high. I mean, high enough that I definitely want to see some replication here. For context, about 10 to 20% of the general population complains of insomnia. You know, a lot of us have that. 10 to 20% is a fair number. This was a study actually out of Asia, which looked at survivors of COVID-19 who had a mild case. They weren't hospitalized, and it found, as you pointed out, 76%, 3 out of 4 of them had insomnia up to 6 months after COVID-19. Now, this is a complaint I've heard about from my patients as well. I don't think I've heard about it from 3/4 of my patients, which is why that seems high. But if insomnia is something that has kind of cropped up since COVID-19 in you or a loved one's life, you might have an explanation here.
That is a big number. Dr. F. Perry Wilson from Yale, appreciate your time. Have a great Monday.
Sure thing, you too.